Hey everybody, welcome to your 23rd health hack. So I know we've been gone for a couple of weeks, and it's one of those things, the holidays, and then we came back with the detox, and then things kind of got crazy around the office. But I just want to welcome you, and what we're going to be discussing today is, should I get adjusted before my surgery, after my surgery? Like, what am I supposed to do, doc? And the answer to that question is invariably yes. You should always get adjusted. You always want to get your nervous system cleared. I always base these hacks on what's going on in the office and kind of what I'm seeing with the general public and what I'm seeing from the patients that are coming in. And one thing I've noticed is when surgeries are necessary, because there's a time and a place for that, obviously, it's emergency room care, and sometimes there's surgeries, because there's a lot of medical doctors out there, all their liability insurance is like through the roof, like it's a couple of $100,000, like I said, and I think that was like hack number 10. I can't remember what hack, but we talked about that. How their malpractice insurance starts at like 130 grand, 200 grand, whatever it is, right? And so, there is a time and a place for surgery, but even when we're having a surgery or going through the process of having one, or even when we're complete with one and done with one, we can always get adjusted. I always tell people that the most important bone in your body is that brainstem bone. That's that first bone called the atlas, okay? That bone runs life, because life comes above, down, inside, and out, from the brain down the spinal cord and out over the nerves to every cell, tissue, and organ. And so the people I've had that have even had surgery, like literally I had a lady in here, and she had had 3 failed spinal surgeries at C6 and C7. She came in, we saw it on film, it was clear as day that there was a lot going on there. And she'd never really been under holistic neurological chiropractic care. And she's like, well, can you help me? And I said, absolutely. Because there's segments above and below those 2 fused segments that need life flow, that need innate working, that need that innate potential being able to get from the brain down the cord and out to the organs. And so I said to her, the most important thing we could do is adjust C1, the atlas bone or brainstem bone. Hands down, that is the most important bone that we want to work with in that area. And so got her coming in, got her into the office, all that, and she has a surgery probably a month into care. And one of the really cool things about it is she had shared with my wife and I that on her first 2 surgeries, one of the things that she was dealing with was, like right after the surgery for a couple of weeks, she would lose her speech. She was feeling 20 out of 10 pain, right? And she was down for 2 or 3 weeks. Not able to really work, move, do anything. So her life is just being restricted. She's miserable, she's in pain. And this happens a couple of different times, that she's basically destroyed by them on the same surgery. So when she's starting the process and thinking about coming in, we had to really encourage her, because she's like, well, I'm having surgery, what can you guys do for me? And I'm like, well, you have 30-something odd segments above and below the areas that they fused. And unless we don't want to get the other areas fused, we got to start working with them. So we started adjusting this first bone, the atlas bone or brainstem bone, and probably a week after the surgery, she said, Doc, I want to tell you something incredible. I want you to know that I haven't lost my speech. I don't have any pain at all whatsoever, and I'm back on my feet. And I was back on my feet after 4 days after the surgery. She said, Doc, that's never happened. She said, it's a miracle. And I said, no, it's not a miracle, it's actually your nervous system. That's the way it's supposed to work. And when you release that internal power and you allow innate to flow, that's what happens. That's why we see all these miracles here. Because people are connected, they're getting reconnected to life. And that's what it's all about. And that can happen to you too. That's gonna happen to you. So if you've got to have a surgery, whether it's in your knee, your foot, whatever the case may be, right? And there's always stuff that we can do preventatively, right? And that would be what we would want to do. But there's a time and a place where, there are limits to matter, and maybe things have gone so far, not necessarily with spinal surgery, because I think there's a lot of exceptions to spinal surgery, but with other surgeries where, hey, the person's, medically that they have to do that, and medical doctors recommending that. There's just no ifs, ands, or buts about it, because they reached a point of crisis where their chemical, physical, emotional stresses, their bucket, if you will, was overflowing, and they don't have a choice but to do surgery. But my question to you, and what I would really implore you to do is, Get your friends and family in here. Let's start getting people checked. Because if we can prevent that, then we can prevent a society that's over-medicated, over-surgerated, right, and doesn't have all this metal in their body. Let's prevent that. Let's start now. Let's start now doing that. So if you're currently a patient here, you've already been checked, or you've come by, or you've seen our signs, or maybe you've met us out at an event, let's get you in here. Let's get you checked. Because there's no way for you to know what's going on internally and whether this bucket's overflowing, right? Unless we get it checked. Because I don't know about you, I wouldn't want to hit full-blown crisis. My bucket's overflowing, right? And I'm in a situation where cancer's imminent and all these crazy diseases are imminent. I want to prevent that. So let's start doing that now. So if you've got something going on and you're worried or you just want to get checked, call 760-385-8352, 760-385-8352, Health from Within Family Wellness Center. All right? What we'll do is we'll offer you a $700 preloaded gift card. It'll cover your exam, your consultation, your results. And all you do is you pay a $40 administrative fee. $40 for a $700 process to change your life and permanently and cumulatively alter your life. This isn't just a physical thing. It's not just a chemical thing. It's an emotional thing, right? And when you get a health change at Health from Within, you get a life change too, okay? So I know we'll hear from you. Call right now. Just say that you saw this health hack. We will honor that promotion for you, okay? Every week we'll be coming. Sometimes we might be a couple of minutes early, but we'll be coming to you live at 7:30, all right? And I wish you the best. God bless you. I look forward to helping you. Have a great day. Take care.